For the rest of this week and next week's class, we're going to focus on engagement, both individual engagement or one-on-one, and community engagement involving groups of publics or stakeholders. We talk about getting engaged. It has nothing to do with roses or wine or very special pieces of carbon and gold. The principles for planning engagement aren't that much different than they are for planning strategic communication. The important thing is that you take the time and actually do the planning. I'm going to share my journey in engagement in healthcare communications over the past 10 years. In April of 2005, the Ontario Ministry of Health and Long-Term Care closed its regional offices and replaced them and the district health councils of the day with 14 new organizations across the province. These were called Local Health Integration Networks, or LHINs. The networks were a key component of the healthcare transformation agenda. LHINs were mandated to provide essential strategic work of planning and funding healthcare systems in concert with community needs and interests. The creation of the LHIN system signified Ontario's first step toward regionalization of the delivery of healthcare. Now, LHINs are not-for-profit statutory corporations designated as Crown agencies and governed by the Local Health System Integration Act of 2006, otherwise known as LICIA. The ideology behind the creation of the 14 LHINs in Ontario is that community-based care is best planned, coordinated, and funded in an integrated manner and at the community level because local people are best able to determine their healthcare service needs and priorities. LHINs are required through the Act to engage in community engagement on an ongoing basis. Under LICIA, the term community includes patients, health service providers, and employees involved in the healthcare system. The scope of community engagement is not prescribed, but can include anything from holding community meetings, focus groups, to establishing advisory committees, or a whole host of other activities. So a public opinion poll conducted by ECOS in 2002 showed that a vast majority of Canadians, 78%, believe that it's very important for citizens to be involved in major decisions affecting the healthcare system in Canada. A more recent poll shows that 85% of Canadians would feel better about government decision-making if they knew that the government regularly sought informed input from average citizens. So taking the pulse, the primer on public involvement put together by the Health Council of Canada in July 2006 basically stated that given that healthcare is a publicly accessible system and it's funded through taxation, that citizens are directly affected by the decisions made about the system, whether it's from a patient perspective, such as ensuring that certain drugs are covered through Medicare, or ensuring they receive timely access to quality care in an emergency room, or whether that be through their financial support of the system through payment of sales and other taxes. It follows then that decision-making around resource allocation and spending prioritization has a direct impact on citizens. As a result, participation by members of the public in resource allocation and spending decisions should be authentic and consequential. Unlike other parts of the world, such as South America, Asia, and parts of Africa, there's not been significant involvement by Canadians in overall budgetary matters. According to the Lukensmeyer report in 2006, these processes are often highly politicized, overly influenced by moneyed special interests, and aim simply at diffusing contentious issues as opposed to actually resolving them. Participatory budgeting, defined broadly, is the movement to make transparent and subject to public influence the expenditures of government. We're not there yet. So the government, though, wants healthcare to speak to the consumer about their expectations. Is anyone familiar with the typical journey into the public forum? I'm going to post a link on our bulletin board. It's a promo for the Parks and Recreation's first season, and really shows kind of what community engagement can really look like. But what does it happen when it's at the hospital level? Given my experience with hospitals, I'm going to use an example from them. This is really a prime example of a real-life situation that took place in 2008. A hospital system needed to gather some input from the public, so they put together an event and printed an ad. Community meeting, all welcome. What? Healthcare costs overtake funding, the impact on you and your family. Wow, the community is invited to come out to hear about the hospital's plans to change services to meet budget challenges head on. It starts with a half-hour overview and presentations. Boy, that sounds to me like death by PowerPoint. And then it's opened up to an hour of open questions and answers. Hey Martha, get your coat on, this is going to be a gas. How do you think people are going to approach this meeting? Who's it going to attract? Well, that was the ad. Who does it bring out? Well, it'll certainly bring out the mad, the people who are really angry, and it's likely going to bring out the sad, the people who really need care and are sad about any form of changes that might be happening. It'll also bring out the people who like a good public row. It'll bring out the bad. This is what it looks like. A sea of people lined up at the microphones, ready to blast hospital officials and board representatives. Does this form of engagement really do anything? Do people feel their voice has been heard? Does it create goodwill between the hospital and the community? What does it do to the level of trust that people have in their organization? Does it make better decisions? So it's not just hospitals that are struggling with either. After a lot of difficulty in their early years to try and figure out the best ways to engage everyday people in decisions about healthcare, the Linds decided to go to the community to learn more about what people wanted. They had this mandate that they needed to engage, but it wasn't necessarily working, so they wanted to go directly to the people to see what they needed. So working with a unique citizens assembly group called Mass LBP, they came up with an initiative called Engaging with Impact, and 3 Linds were involved with it. The 3 Linds were Toronto Central, Northwest, and the Southeast. So I'm going to share a video. There's a link on the discussion board of the actual event where citizens were describing what it was that they were looking for in their healthcare system. There was a report that was created as well, and it advocates investing in a culture of engagement that in time can transform the business of healthcare system administration. This is the culture that citizens want and that they increasingly expect. But remember our discussion about culture, it often takes time to get there. So Engaging with Impact addresses those who believe that community engagement can be a major driver of health systems reform.